This is the one-handed surgical knot that I showed before, this time with an explanation. First, when I get the suture in my left hand, I make like a chopping motion, which you'll hear a lot of times, or you'll see a lot of times done with the third and fourth finger. I just chop with all my hand as I'm pinching, I guess, the proximal end of the suture. Once I make that chopping motion, you'll notice that I have the top side of the suture in my right hand. I grab it in my hand, make like a little pistol, which you'll hear people say as well. And as I pull it over my middle finger, I can then slowly pass it underneath. Show again. So I chop, pull this over just the tip, just the distal portion of my middle finger. That allows me to bring it underneath just by flexing my middle finger. As I flex it, I'm catching the string on top, which is my left hand, and I squeeze my two fingers together, my third and fourth digits, and I bring them down and under. And that's my first. And of course, push the knot down. That's my first throw. Now, I'm going to do that one more time. You'll see a lot of surgeons do this. I chop again. My little pistol grip here again. Over the distal part. My third finger. Run it underneath. Pinch these two together. So it's my third and fourth finger right here. Pinch those. Pull it under. Now you can see the string back here. You push it down. Every time push it down. So it's fairly snug. And you can see how snug it should be. You know, you shouldn't be cutting these or ligating these two rubber pieces, but now comes the other throw, which will lock it. You make a kind of pistol grip with this side. The key to this side is my lateral portion of my left thumb here. I want to push the suture out just a little bit so it's under tension. Bring the string or the suture that's closest to me up over just the middle, most distal part of my finger, and I move my thumb until I loop that around, and I grab these two fingers again, my second and third digits, and this time I'll push down. And I'll show that again after I make my other throw. Chop over the top, third and fourth digits together, push it down, pistol grip. Make sure you have this string right here, the suture. In this case I'm using 1/0 Polysorb, which handles a lot differently. Sometimes it kinks up on you a little bit. So the bottom string comes up, run my fingers underneath, right here is a little bit different technique. I'm going to grab the suture between my thumb and first finger, second finger, and push down with my middle. One more time. Chop, chop, push down. Now I'm scooping underneath, and it's at my distal part of my finger at the joint. This is going to come halfway. Kind of bisect that right there. Now again, the thumb, super important. As soon as I bisect that, I'm going to push my thumb a little bit. Pushing, pushing, catching it with the tip of my finger, and grabbing this little piece right here. Now take your time with this, you can do this, and slide the knot down. Very nice. I hope you enjoy this, and I hope you practice a lot. I know it's not easy, especially if you're if you're a student. 3 hours into the surgery, they ask you to close, and you're freezing, and your hands are cold and dry. But you can definitely do this. Try it nice and slowly at first. Thank you.